Good evening. I'm Hartford Healthcare's Tina Varona. Thank you so much for joining us for another Facebook Live edition. Well, thousands of golf fans will descend in Cromwell all this week to watch some of the best golf players in the world compete in the Travelers Championship. And part of the players' preparation is making sure that they stay healthy and injury-free. Joining us is Wendy Nichols. She's a physical therapist who oversees the Center for Musculoskeletal Health at the Bone and Joint Institute at Hartford Hospital. Good evening, Wendy.
Good evening, Tina.
Well, of course, we invite you to ask Wendy a question. She'll be here for the next few minutes. Anything golf-related injuries or injuries if you're an athlete yourself and have a question for Wendy about the Bone and Joint Institute. So since we're in golf right now, it's all about golf for this whole week. Aside from the players perfecting that golf swing, they really want to be careful about injuries and potential injuries. How do they do that? What are some of the injuries that they're prone to getting?
Golfers are typically prone to things like low back pain, mid back pain, shoulder strains, particularly the rotator cuff, also elbow pain too. More commonly, it's known as golfer's elbow.
So what can they do to sort of prepare or to prevent some of these orthopedic injuries? I would imagine stretching is key.
The best way to prevent any injury, and this goes for all sporting activities, is to have a proper stretching program. Mm-hmm. And a lot of people forget to stretch. You know, you have the weekend warriors that just want to go out and do what they love to do, and they forget to stretch, and that's typically how we see injuries happen.
No matter what type of athlete are you, is it the same type of stretching, or golfers are going to be different than runners? What should we be doing?
There is a stretching series that we have specifically for golfers. Runners have their own specific stretches that we do for them too.
So let's talk about the Bone and Joint Institute. There is an assessment program at the Center for Musculoskeletal Health, and this is really interesting because this really sort of dissects an athlete's performance and how a runner, how they run, a swimmer, how they swim. Talk to us about how you actually do that.
So we have a state-of-the-art motion lab at the assessment center. We have 12 cameras in the motion lab, and we can really see, it helps us capture the 3D motion mm-hmm. that an athlete is doing. So we can really dig down to see what is breaking down, what's not moving the way it's supposed to, and we can address it at that level.
So we're talking again to Wendy Nichols. She's a physical therapist. She oversees the Center for Musculoskeletal Health at the Bone and Joint Institute at Hartford Hospital. And we're talking about ways, if you're an athlete or if you're just a fitness guru, ways that you can keep yourself injury-free. Let's get back to the assessment center. Take us through step by step. If someone comes in and let's say I'm a runner and I'm coming in for an assessment, what can I expect?
Well, all athletes that come through the center get a full assessment that really looks at the overall health and well-being of that athlete. So every runner that comes in, you start off with a stack of assessments that you fill out, and from there it will trigger your resource team. So we'll look at things like your diet and nutrition, and if you need a consult with a nutritionist, we can get you in touch with one. We also use an assessment tool that helps us really look at the psychological state of the athlete, which really helps, because if you're not psychologically in the right place as an athlete, that's really going to hinder your performance on the field or on the course.
Yeah, and so this is a sort of comprehensive approach. You have a nutritionist, you have physical therapists, so it's sort of a comprehensive approach to sort of delving into that particular athlete and their performance.
Right, it is.
So is this for seasoned athletes? Could it just be for somebody who just likes to go jogging, or somebody who's an occasional swimmer, or not so much of an athlete?
It can be for anyone. Mm-hmm. Anyone over the age of 10, we can see them in our center. Even at that level, we're looking at the whole person versus just their injury or what they use when they're doing a specific sport.
So when they go into the motion lab, what can they expect? There's cameras all around. It's kind of neat to see this. But when they go into the motion lab, you yourself is by the computer kind of watching. Take us through that process.
So when they go in the motion lab, we actually set them up with marker sets. So we put markers all over them depending on what sport they participate in. So runners, they'll be primarily from the pelvis down. We put marker sets on different locations. And then we get them on the treadmill, and we really look at how they're moving based on those marker sets.
Now, when you find, let's say there's a runner that's maybe not running quite right, and then you can show them, you can actually show them what they're doing wrong. And that can really that can really help prevent injuries, but then you sort of have to get them out of these habits. How do you do that?
So we also do a functional movement screen for all the athletes too, which looks at their flexibility and their strength too. So what we can do is we have a bridge program, which is a program that's designed to really bridge the gap between therapy and returning to sports. This program really works on the strength and flexibility of the athlete specific to their individual sport.
And some of the equipment that you utilize too. The AntiGravity Machine. Talk to us about that. That is pretty cool.
Yes, the AltiG is a tool that we have that we can use, and we use it for all different diagnoses. But particularly like runners, we'll get them on there just to get them moving again. When you're a runner and you're not able to run, it really, psychologically, it has a huge impact. So just being able to get a runner on a treadmill and have them go through the motions really makes them feel so much better.
And even, not just aside from athletes, patients that have had hip surgery or knee replacement surgery, this also works for them as well. Tell us how that helps.
Absolutely. We can get them up and moving quicker than we could before because they're in this bladder that suspends them a little bit. So we can do things like squats and lunges in this bladder that suspends them. So it takes the weight off of the joints and it helps with the pain.
And you can control how much weight that they actually can put on there, like if it's 20% or whatever. So they're actually feeling like they're walking on air probably and can do a little bit more, thus probably speeds up the recovery process.
Absolutely.
Right?
We can take them all the way down to 20% of their body weight. At that point, some people just start floating and they can't even get back down to the ground, which is a very unique feeling. But we can take them down as low as we need to take the pain off of the joint.
How can I get that feeling all the time?
I wish, right?
Carry this around with me everywhere.
Once you go back to 100%, you're like, wait a second, I don't want to do this.
Right, it's probably that much worse. You probably feel like you weigh 1,000 pounds.
You absolutely do.
So let's talk about we talked about the assessment center, the Center for Musculoskeletal Health as a whole, though. This is a real differentiator. It's a real game changer, and it's been compared to an Olympic training facility because we do offer a lot of what you would find in an Olympic training facility that Olympians would use or professional athletes would use. Talk to us about the center as a whole.
So I know, I think every NFL team has the AltiG, the anti-gravity treadmill, but we also do VO2 max testing, which looks at the oxygen consumption of the athlete, which is very high level, and they do that for Olympians.
Yeah, and that's all about breathing. Breathing obviously is very important too in keeping your pace and probably could help improve your time, I would think. Right?
Yes, because it looks at how quickly you fatigue when you're doing an endurance activity. So if we can look at that and see, if you're not really taking in as much oxygen as you need to, we can do certain things to help improve that, which will overall improve times and performance.
Sure. And what are some of those things? I mean, because that's hard. I mean, you take yoga classes and they sort of teach you how to breathe, but it's really hard to change your breathing pattern.
It is very hard. Working on core, actually, that breathing really comes from the core. So even just working on that can sometimes help improve breathing. And how long
does the assessment take? So if somebody comes in, what's the commitment?
If you're doing a motion lab, we have different tiers for what we can look at. So if you're doing the very highest tier for a sporting activity, it can take anywhere up to about 2 hours.
Okay, and how long is the commitment in terms? Is it 6 weeks? Is it?
It depends. Everyone's different. It really depends on what we find and what the person's able to do too.
Right.
So if they're only able to come every other week to the center, then obviously it's going to take a little bit longer. But it really depends on what we find at the level that we're looking at.
And fitness classes, this is another big area that you offer, a plethora of classes. Give us sort of a breakdown and what folks can expect from some of those classes.
We offer a variety of classes. We have a high-intensity training class that we're offering, yoga, tai chi. We do weight training for the community over 60. So, we've targeted every age group that we could. We're also going to be doing strength training for the endurance athlete too. So anyone who's training for the marathon coming up in October, this would be a great class for them to take.
Yeah, and I would think that it just is long-term benefits to not only enhancing your performance, but just staying healthy in general.
Yes, and that's what we really suggest is if even in the off season that you're doing something to stay strong and stay flexible. What we see mostly is when people stop doing things and then they try to go back to it and they go back too quickly, that's when they really get injured. So even if once you've done your activity or you've done your event that you've been training for, just to keep up some level of fitness is really beneficial.
Yeah, and I would think, let's say somebody goes through the assessment program and then they run the marathon or whatever event that they're competing in, and then they sort of go back to just doing it as a hobby, and then they go back to maybe training again for another event. Would you suggest having another assessment just to make sure things are still on the right track?
Oh, absolutely, because so much can change over a period of time. They may not have been stretching as much as they were before, so now they're tighter, and things just break down over time too. Right. So I absolutely recommend getting assessments periodically.
Periodically. How often would you suggest that?
Probably, I would say once a year would be good. If you do it before your season or before your training season starts, that'll give you a good baseline and things to work on throughout the season. So I think once a year would be.
So for folks out there that are training, they would be training now for the Hartford Marathon and Boston Marathon coming up. What would you suggest to them in terms of maybe starting the assessment? When would be a good time to do that?
Well, we're probably about 15 or 14 weeks to, I think, the Hartford Marathon now. So this would be a great time because training programs are just starting up for the full marathon. Half marathon programs will probably start up in about July. So this is really a good time for all athletes to get their assessment done.
Yeah, sure. And it's definitely worthwhile. And I would think that, I would imagine that it could improve your performance and your time even too. Do you time them as well?
Yes, so we do a lot of pre-testing as well as post-testing. So we do look at where you are before and then where you are after the program.
So you can really kind of track your progress and see those results.
Right.
And I think that that's important because when you can actually see the improvement or see what you're doing wrong, because you really don't know and you just sort of go. But when you can actually see it, I think that's a motivating factor as well.
Right, and we also do interval assessments too. So it's not just pre and post. So every now and then we do an assessment just to see where you're at or if there's anything else that we should be focusing on other than what we are focusing on.
Which is so vital. And stretch, stretch, stretch.
Absolutely. Don't forget that.
The sport is. Wendy Nichols, thank you so much for joining us.
Thank you.
We appreciate it. There are a number of classes that Wendy had mentioned. If you would like to see a complete list or register for any of those classes, just call that toll-free number 1-855-HHC here, and we'll get you connected to all of those classes. So thank you for joining us for another edition of Facebook Live. I'm Hartford Healthcare's Tina Varona. We'll see you back here next week.